our webinar today so that everybody can go back and review it at a later date. You are in the right place if you're here for Senior Resources 101, which is an overview about the Agency on Aging. Senior Resources is the Agency on Aging in Eastern Connecticut, but as Joan Wessel, our director, is going to tell you, we do a lot of similar things as other areas. My name is Allison Dvorak, and I am the Director of Education and Training for Senior Resources. So I'm hoping that with this whole COVID thing, and we're trying to do a lot more outreach this way, that we can stay connected with you and people that you work with. We go to the next slide. Great. One thing that we've all had to learn a little bit more about with working online in an online format is how to work in these different programs and systems. So maybe you're familiar with Zoom or GoToMeeting or any of these types of things. It's kind of like tomato, tomato. This one is WebEx. And what we've found is that a lot of the features will pop up only when you put your mouse around the bottom of the screen. So if you're not familiar with working in this format and you are on a computer, feel free to just kind of roam your mouse around and get down to the bottom of the screen where you'll see a series of different colored bubbles pop up. The first one to the left is muting, and we are keeping everybody muted throughout the presentation just so that it's not distracting. We're also not having anybody's personal video showing in this. So I know, darn, you could have stayed in your pajamas all day, but we're not having that be part of our recording today, also because this is being recorded and we don't want that to show up anywhere else. And then the other feature is the third one in from the left, the chat bubble. That is a great way to send in questions as we're going along so that we can get to them. For those of you that are calling in on a phone, of course, you're not going to see these our screens and what we're talking about, but we are not just covering what's on the screen. We're talking about each of the programs as we go along. So as I said, this event is being recorded. We will have closed captioning as a transcription when we post it on the website. And we're going to have everybody stay muted, as I said. If you want to optimize the look of your screen, I highly recommend going to full screen view. And you can get to that by either hovering your mouse up in the upper right-hand corner where it'll look like a stack of papers. And if you click on that, then what you're looking at should cover your whole screen. But if not, and you can see what we're talking about, that's fine too. Again, play around with it. It won't hurt anything. If it seems like you've lost everything, but you can still hear us, it means that your computer kind of minimized everything and you just look down at the very bottom of the screen where all of your little program icons are, and there might be one that looks like a blue and green globe, and that if you click on that one, it'll bring us back up to where you can see us again. And as far as this muting everybody, I know that kind of seems awkward because you can't ask your questions, but we will stay on. All of our Senior Resources staff will be staying on the call and answering any questions that you might want to ask over the phone after we get through the whole presentation, and also for those that can, using the chat feature as we go along. Okay, next slide, and I'll hand it over to Joan.
Welcome, everyone. I hope everyone can hear me. We had a little technical problem with my speaker earlier.
You sound great.
I welcome you. Oh, great. Thank you. Welcome you today, and thank you for participating. We're going to give you some quick details about who we are and exactly what we do. Senior Resources has been around for quite a while now. We've been in existence actually since 1976, and I've been with the agency since 1986. So I've become a fixture in the building at times. We do cover a large geographic area. Of all of the AAAs, the area agencies on aging in Connecticut, we cover 56 towns, which is the largest geographic area. There is another area agency in the state that covers 14 towns by comparison. We take up all of New London County, Middlesex County, Windham County, and if that were not enough, they gave us a couple of Tolland County towns as well. Our agency is really in existence to be an advocate for, a provider for services, and an educator for older population, our older population. Our population consists of, in Eastern Connecticut, we serve about 120,000. We have available to us about 120,000 individuals over the age of 60. We really stand up as a voice for those that are not able to speak for themselves. So our mission is basically to grow communities where seniors can thrive. And for that, everyone has a different level of thriving. And so we try to make sure everyone can be able to work in or live in their community that suits their needs the best. Next slide, please. This is the map of Connecticut, and as you can see, we are the purple side, geographically the largest, like I just said. On the left-hand side of this slide, you're going to see some of the activities that all AAAs do. All of us have some strong areas and some common goals. We do navigation, which includes Medicare counseling. You'll hear about in a little bit. We do benefits screening, benefits education. We have a couple of caregiver programs where we can provide caregiver respite. Our staff will be providing information for you on some of those services. We do some case management. There are a couple of other AAAs that do the Connecticut Home Care Program for elders. But we don't in Eastern Connecticut, but we do have a lot of strong relationships with the other area agencies on aging. So if you're calling in or visiting us from another area right now, you can always call our 800 number and get to the area agency on aging that is in your area. We work very closely together, and it's a good network of individuals. Just in the state of Connecticut, here, there are 5 of us. Across the nation, it's a stronger network with about 650 different area agencies on aging nationally. Every state has different policies, different procedures, different ways of doing business as the area agencies on aging. So I am going to turn you over to some of our staff, our very talented staff this afternoon, and they will explain in detail some of the programs that we share with our consumers. Next slide, please.
Okay, well, thank you, Joan. Can everyone hear me okay?
Yes.
Perfect. So thank you everyone for joining us today to just simply learn about our wonderful agency. My name is Laura Cruz, and I am the Director of Benefits Access. I have been with Senior Resources for 15 years. I began my work here as a secretary, and with my interest in the Medicare program, I began taking part of many different training opportunities, which led me to become the Choices Coordinator about 8 years ago. I would like for you to picture the Choices program as a large umbrella, and under each umbrella spike is a different program administered by Choices. So as you can see on the slide, Choices is an acronym, and a large one at that, and it stands for Connecticut's Health Insurance Assistance, Outreach, Information and Referral, Counseling and Eligibility Screening. So hence the reasons why we tone that down to simply just say Choices. But for the next few slides, I'm going to talk about the State Health Insurance Assistance Program and the eligibility screenings, but I'm going to leave the Senior Medicare Patrol information and referral and volunteer opportunities to my colleagues. So under Choices is the State Health Insurance Assistance Program. Every state in the United States and U.S. territories has a state health insurance assistance program, but in Connecticut, we simply refer to it as Choices.
Choices trains in-kind professionals and volunteers to become counselors to assist Medicare beneficiaries in Connecticut. In addition, all 5 area agencies on aging have Choices staff at the agency. So at our agency, it's myself, my 2 cohorts, Sally and Lori. They help me out tremendously with the Choices program, and we have several cross-trained staff members in their respective programs that help out with the Choices program. Choices counselors are not insurance agents, brokers, or financial planners, but rather we provide free, unbiased information about the Medicare program as a whole. And this includes information about Medicare Parts A and B, what it covers, when to enroll, and how to enroll. Medicare supplemental plans, information on what they cover and the different plans available in Connecticut, and provide guidance on how to enroll into a supplemental plan. The Medicare prescription drug plan, known as Medicare Part D. Counselors will screen Medicare beneficiaries using their prescription drug list to help determine what prescription drug plan will work for them and help them enroll in a plan via the Medicare Plan Finder tool located on Medicare.gov. And the Medicare Advantage plans, known as Medicare Part C. Counselors will discuss the myriad of different Medicare Advantage plans that are offered in Connecticut, and again, screen their prescriptions to ensure beneficiaries are enrolling in a plan that best suits their needs and provide enrollment assistance, again, using the Medicare Plan Finder tool located on Medicare.gov. In addition to providing information, Choices counselors are trained to provide eligibility screenings to help determine if you may be eligible for certain state and or federal programs, which can help make Medicare affordable, as well as programs to provide in-home services. Choices counselors provide application assistance for such programs by helping you complete either a paper application for the state of Connecticut Department of Social Services or provide assistance with applying online through the state's Medicaid system entitled the connect.ct.gov portal. Next slide, please. Choices provides outreach to the community, and this is one of my favorite things to do. I love going out into the community and talking about Medicare. The presentations are also free to attend, always free to attend, and information is provided by a certified Choices counselor. Some of the types of presentations Choices provides are new to Medicare, also known as Medicare boot camps. This is a great presentation to attend if you're newly becoming eligible for Medicare or just want to learn a little bit more about it. I have 3 Medicare boot camps scheduled in August, and feel free to visit our website to register for one if you wish. Another one of the overviews that we do is called the Medicare Savings Program Overview. This provides information on how to make Medicare affordable by enrolling into a financial assistance program that helps pay your Medicare premiums. So I have 2 presentations scheduled for this month, and again, I will direct you to our website to register for one of the 2. Other outreach activities performed by Choices are the annual Medicare Open Enrollment events scheduled. Typically, they're scheduled between October 15th and December 7th at various community-based organizations. Unfortunately, due to the pandemic, this year, the annual enrollment events are going to look much different. But this is where you can sit down one-on-one with a certified Choices counselor to look at the plans that are going to be available for the following year, whether you want a prescription drug plan or you're wanting to enroll into a Medicare Advantage plan. And Choices counselors will screen you to see if the plans, what plans suit you better, and actually or help you enroll into them, again, using the Medicare Plan Finder tool. But to speak with a trained certified counselor in your area, and especially with our 56-town region, give us a call at our toll-free number of 1-800-690-6998. If we're not the correct agency for you, maybe one of our sister AAAs, we will definitely help you reach out to them. Next slide, please. So, in addition to our Choices work, Senior Resources Agency on Aging, with funding from the National Council on Aging, was granted to become what's called a Benefits Enrollment Center. The Benefits Enrollment Center focuses on helping low income people with Medicare access programs that pay for healthcare, food, and more. Using web based tools in a person centered approach, our Benefits Enrollment Center helps low income older adults and persons with disabilities find and enroll in all benefit programs which they are eligible and create a seamless, coordinated, community wide system of benefits access. So prior to the pandemic, my colleague, Lori Napolitano, our benefits enrollment specialists, would visit local community-based organizations to provide one-on-one screening and application assistance. So while all in-person assistance has been halted momentarily for the time being, do note that our agency is still providing services, application assistance, and other assistance to callers. It's just simply remotely. But please, again, give our agency a call at 1-800-690-6998 and feel free to speak with Lori Napolitano. And I will pass it on to the next speaker.
Great. Thanks, Laura. Can you move to the next slide, please? What I love about that program is that the number on the back of the Medicare and You book that everybody gets refers right to our Choices Counseling and that program, and it helps so many people. So a part of the Choices program is the Senior Medicare Patrol, or SMP, and this is Allison again, and I'm the coordinator of volunteers for the SMP program. What I like to point out here is that it's hard to imagine that Medicare loses almost or maybe over $60 billion per year to fraud and abuse. That's 60 and billion with a B. And that is pretty scary because we can imagine that if Medicare loses, we all lose, because that's just a lot of money for the United States to lose in fraud and abuse. So what we see is that Medicare beneficiaries are actually the best eyes and ears to see what's going on if there's something that can be prevented from happening in the first place, and then also to finding cases of fraud and abuse. So one of the main things that we like to remind people of is always keep your Medicare number safe. Don't give that out to people other than your medical providers, your doctor, because if somebody gets somebody's Medicare number, they can potentially be using it for fraudulent billing. So that's one way that some of that fraud and abuse occurs. The other way is to detect. So we want people to really look through those papers that come in the mail saying that you saw the doctor on such and such a date and this test was performed, and that that's all valid information. And because sometimes the doctor's office may make a mistake, and that, that kind of adds to that potential number, but can be rectified. And then also to report it to our SMP program. So that would be calling into our office or speaking about it with the Choices counselor, because they're all well informed on that. So those are the best ways that we can work to get that number of lost dollars down and reduce the potential incidents for fraud and abuse. Certainly, as with any scams, more things happen when there's something like a pandemic going on. So phone calls are coming in and people are more isolated. So even more reason to be diligent and vigilant about keeping our medical information safe. And we will have training on being a SMP volunteer in October. It will likely be an online training, and we like to say that the Choices training is fantastic. So anybody who really wants to work and counsel people in Choices issues, I highly recommend going to the Choices training. But if you're not into that many days and that many hours, and you may not actually be in a position to meet face-to-face with people about choosing their plans, then you very welcome and may enjoy working as an SMP volunteer more, because we go through a lot of those ins and outs of Medicare, and then also the ways to protect our information over time. So contact me if you're interested in that training then. Okay, and I'll pass it on to Joan.
Hi, I'm Joan Marshall. I've been the Respite Program Coordinator here at Senior Resources for the past 21 years. The Respite Program is a state-funded program that helps pay for services to give people caring for someone with Alzheimer's or another type of dementia a break from their caregiving responsibilities. The funding is offered in an annual grant of about $3,500 per year, per fiscal year, which is the state fiscal year from July 1st to June 30th. And those funds can be used to pay for a variety of respite services. Last year, we assisted 170 families with almost $300,000 in service funding and care management. The eligibility guidelines for the program apply to the person with dementia. Their income cannot exceed about $47,000 per year, and they cannot have more than about $126,000 in assets. Countable assets for this program are monies in an account: CDs, stocks, bonds, IRAs, savings, and checking accounts. A home or other property do not count as assets for this program. The program also requires a 20% copay. We will pay the agency providing the services in full, and then we bill the family for the copay based on services actually used. In instances of financial hardship, the copay can be waived. There is no recoupment provision for this program, so there's no expectation that the monies used under this program are repaid. The application for the program includes information about the caregiver, the care recipient, and services needed. The application is on our website, or it can be obtained by calling our office. When we receive an application, we not only work with the family to provide respite, but also screen for other programs that might benefit the caregiver or the care recipient. Once the application is completed and returned to us, we reach out to the caregiver to discuss the specifics of caregiving responsibilities and the respite services needed. We then set up the services through an existing agency or facility and monitor the care plan that can include in-home services such as homemaker, companion, personal care aide, or home health aide. We can also fund emergency response systems, and we can pay 4 days of adult daycare or a short-term stay in a nursing home or an assisted living. There's also a self-directed option where a family can hire a non-agency worker and go through a fiduciary to have that individual paid with the grant funds. So that program is intended to give a break to a caregiver, and really a short-term break. We also provide support to caregivers and families through 2 educational programs: Powerful Tools for Caregivers and Dementia Friends. The Powerful Tools for Caregivers program is a 6-week course designed to help caregivers take better care of themselves while caring for a friend or relative. The classes provide tools to help with things like stress reduction, improving self-confidence, time management, goal setting, problem solving, general communication, accessing local resources, and making tough decisions. Those courses have been offered at local senior centers and hospitals, and we typically run them 2 or 3 times a year throughout the region. The Dementia Friends program is a global movement changing the way people think, act, and talk about dementia. Our 1-hour information session helps everyone in the community understand what dementia is, how it affects people, and how we can make a difference for people touched by dementia. And again, those programs have been offered in senior centers, churches, other religious communities, and at hospitals. And either of those programs will be discussed later in this program under the Speakers Bureau. The statewide respite care program offers caregiver support and functions in collaboration with the National Family Caregiver Support Program that Robin Brewer will discuss with the next slide.
Hi, my name is Robin Brewer, and I'm the coordinator of the National Family Caregiver Support Program. I've worked at Senior Resources for 9 years and have been a caregiver myself for 25. The National Family Caregiver Support Program provides small grants to informal caregivers for the purpose of giving them a break from their caregiving duties. To qualify for funding, the person in need of care must be at least 60 years old and have deficits in 2 of the following activities of daily living: bathing, dressing, toileting, eating, walking, and transferring. Services may be provided in a variety of ways: in-home care, adult day, or temporary inpatient stays. With in-home care, services may include assistance with showering and dressing, light housekeeping, laundry, grocery shopping, errands, or they may simply be put into place to provide companionship. With adult daycare visits, the caregiver is provided some free time while the care recipient is out of the home. It's more cost-effective than in-home services, and an added benefit of adult daycare is socialization. Temporary inpatient stays are typically chosen when a caregiver is in need of a longer break or when a caregiver goes on vacation. 24-hour care is provided to the individual by a skilled nursing facility. It has also been used when a caregiver has been hospitalized. Like the statewide Alzheimer's program that Joan Marshall talked about, this program also has a self-directed option where a caregiver can use the funding to hire a person of their choosing to provide the care as opposed to an agency. This program is federally funded through the Older Americans Act with a fiscal year of October 1st through September 30th. Services are provided at no cost. However, a voluntary cost share is requested, and it's based on the income of the care recipient. Assets are not counted in this program. Funding is limited, and per family amounts vary from year to year. Last year, we were able to provide respite services to 120 caregivers with a budget of $141,000. So in addition to respite services, next slide, sorry. Thanks. In addition to respite services, supplemental funding is also available through the National Family Caregiver Support Program. And supplemental funding is used to pay for items that are not covered by medical insurance and for which there are no other funding sources. The eligibility requirements are the same here as with the respite component, meaning that you have to be 60 and have deficits in 2 activities of daily living. Some of the examples of items that have been funded through supplemental funding are bathing devices, such as shower chairs and handheld shower heads, bathroom modifications, such as bathtub cutouts to provide walk-in access, raised toilet seats, grab bars, shower chairs, and sliding benches for transferring. The majority of our funding is used to provide personal emergency response systems, sometimes referred to as lifeline buttons. Many of the individuals that we assist are considered fall risks, so having a way for a loved one to be able to access help when needed provides peace of mind to their caregivers as well. We've also funded air conditioners, lift chairs, rollators, walkers, wheelchairs, and transport chairs. As you all know, incontinence supplies can be very costly, and the funding can be used for pull-ups or briefs, incontinence pads, and bed pads. Nutrition supplements such as Ensure and Glucerna are also items that can be funded, as well as wound care supplies. The funding may be used toward items like ramps and stair glides. However, due to their overall cost, these items are typically partially funded. We can use the funding to pay for one-time emergency items such as appliance repairs, dental services, and prescription drug assistance. So that's not a complete list, but it's designed to give you an idea of some of the things that we can fund. So one may receive respite funding, supplemental funding, or a combination of both. And additionally, if a client is on the statewide Alzheimer's respite care program, as long as they meet the eligibility requirements by being 60 and having deficits in 2 activities of daily living, they may also access the supplemental funding through the National Family Caregiver Support Program. Typically, funding is limited to $750 per family per year. And last year, we assisted 158 clients with supplemental services on a budget of $64,500. Joan talked a lot about the application process, and it's the same application process is in existence for the National Family Caregiver Program. As a matter of fact, it's actually the same application. So Joan and I collaborate together to determine which program would best serve the client. Next slide. Okay, so the National Family Caregivers Program is multifaceted. We also have a program for grandparents who are raising grandchildren. And it is designed to provide financial assistance to a grandparent or a relative caregiver who's aged 55 or older, and they have to be caring for a child who is under the age of 18 or an adult child with disabilities aged 18 to 59. There has been some recent changes in the legislation. So now parents who are raising adult children with disabilities aged 15 to 59, aged 18 to 59, are now able to access funding as well. Although many times funding is available through other sources with this population, and we do look for other funding sources as well. So the program can assist with health-related services such as glasses or dental care, enrichment activities like field trips, sports fees, the purchase of sports equipment, music lessons, karate lessons, even driver education classes. It can help fund basic needs like clothing and school uniforms. The funding can also be used for clothing for social functions that mark developmental milestones, such as proms. It can be used to fund education-related items, such as tuition, books, and school supplies. The majority of the funding for grandparents raising grandchildren is primarily used to fund summer camps, although this year is an exception to that. We have funded before school and after school care, as well as child care during school vacations. Last year, we assisted 44 grandparents and 64 grandchildren on a budget of $40,000. Being a caregiver is quite an undertaking, and support groups are a wonderful way to talk with others who are in similar situations. They actually provide a platform for caregivers to express their concerns. Support groups are held throughout our regions, both for grandparents raising grandchildren and caregivers of older adults. The support groups are facilitated by Senior Resources, and we can provide clients with lists of where support groups are held in their areas. So please feel free to reach out to us with any requests. And that's it.
Great. Thank you, Robin. So our next program to talk about is Live Well, and this is Allison again, but I'm kind of filling in for Lori Rogalski, who couldn't be on the call with us today. The Live Well program is a self-management program that was developed by Stanford University initially. This is actually an international program as it reaches more than 30 countries and it's provided in so many different languages. In Eastern Connecticut, we do the chronic disease self-management program in both English and Spanish, and the diabetes self-management program in both English and Spanish. And then we have a pain management program that is currently, I believe, only in English. What's interesting about this program is that it's entirely evidence-based. I'm trying to figure out how to mute people at the same time here. Okay. It's entirely evidence-based, and this just means that it's been proven effective, and it's been proven effective in a lot of locations and with a lot of people. And what I've taken it as both a participant and as a leader. And I think what's so interesting is that it focuses on what the individual feels they need to change in their life for this next week. You set one little short-term goal, and what are you going to do to meet that goal in the next week? And through it, you're also getting peer support and the leader support. We're always looking for volunteers to run these workshops as well. It's a scripted program, so you don't have to know everything. You don't have to know all the answers, and you don't have to think on your feet all the time. So it's really a great program, because I think one of the images they go through with how effective it is you think about how much time you actually spend with your doctor managing something like diabetes. So maybe that's 15 minutes every 6 months, right? So that's not what's going to make your diabetes better. It's what you do all the other minutes of every other day in those 6 months that makes your diabetes better. So if you know you're supposed to, plan a healthy meal, how do you work towards that? If you know that it'd probably be a good idea if you walked, to the mailbox every day, then how are you going to get to do that? So it really puts us back in the driver's seat and back in charge of making these changes that are going to improve our lives. So it's a really great, fun program, and it's provided in, when we're not in pandemics, it's provided in a lot of community locations. But next slide, please. For right now, we are doing it in a different way, where there's some home study, looking through things, reading the book, doing different activities, and then convening on a conference call with your peers and with the leader to go over these different topics of how to increase exercise or whatever your goal is, whatever your specific thing is. Sometimes it's, cleaning out the closet so that you can focus on the next thing that you need, you need to do to move forward. So contact Lori Rogalski. She has many programs going on throughout our region and is happy to start a new one if there's enough interest in a location. And I'll also put a little personal plug in here. An offshoot of the Live Well program I'm working on with the Ledgely Health District is a cooking program that we're going to be doing in August. That's 4 sessions of doing a cooking class, primarily for people with diabetes. So if you want more information on that, you can contact me later. Okay, and next slide, please. I'm going to move on to John O'Hara's program here, filling in for him, even though I'm familiar with the locations, but he is such a master of this program, but was not able to be with us today. The Congregate Housing Services Program, the CHSP, is a program under the auspices of Senior Resources, where we basically have a resident services coordinator available to coordinate these funded services for residents of certain locations. So this is only this would only impact housing sites such as Gonaden South and Gonaden 1 and 2 in Willimantic, the Eastwind Village and Cedarview Village in Plainfield, Moosip Manor in Moosip, and Salem Village in Brooklyn, and Westfield Village in Danielson, and Little River Acres in Putnam. So for people who live in those areas, they work with John to get into this program. This program is not income or asset based. It's based on the physical need for help with things such as coordinating or monitoring their home care, congregate meals, homemaking, transportation, assistance with bathing or washing their hair or foot care, and then also those personal emergency response systems. So very interesting and great way to keep people living in their communities in those senior housing locations. Okay, next slide, please. And we're going to pass it on to Julianne. Let's see where she is. Julianne, can you unmute yourself?
Can you hear me?
Yep, now I can hear you. Sorry, I might have been muting you and unmuting you at the same time.
Okay, so my name is Julianne Humphreys. I work as a transition coordinator with Money Follows the Person. We're contracted through Senior Resources with DSS. And the purpose of our program is to move individuals from nursing care facilities and possibly hospitals to the community. The qualifications are at least a 90-day stay in a qualified facility and that you're Medicaid eligible. If at the time you're not Medicaid eligible, we can speak with you about different ways to become Medicaid eligible and therefore be eligible for the MFP program. We work with the waivers in the state of Connecticut and to provide home and community-based services. A few of the waivers we work with are the acquired brain injury, DEMIS, mental health, and then elder care and the personal care attendant. All of these programs can be self-directed through a fiduciary or agency-based. And then moving into the community can mean different things for different people. It might go into another congregate type housing. It could be moving back home with a spouse or family. And it could also mean going into your own apartment. And through MFP, you can apply for the rental assistance program. We call it RAP. And if you need an apartment, we can also help find, we can help with the located housing. Also, once you are in the community, we will help with the programs that have already been discussed, the Medicare Savings Plan, uh, the SNAP benefits, and LIS. Also, if people are going to their home, oftentimes once they've been in a nursing home, they may need modifications to their home, which MFP can provide. Uh, there is a limit, but if a person, say, cannot go up 3 steps to get to their front door, Money Follows the Person will pay for a ramp to be professionally installed so that person can live at home safely. Also, another benefit for everyone through the MFP program, we supply them with essential household items. And these are basics: pots and pan, bedding, towels, also bare necessity furniture, a bed, a sofa, a recliner, dining table. And we also provide them with groceries. It's an itemized list, an itemized budget for everyone. And the food is to keep the person safely at home before their SNAP benefits kick in. Sometimes there is a delay of 7 to 10 days before they are able to utilize their SNAP. We have a wonderful team. The other transition coordinator is Megan Eichelberg, and our housing coordinator is Deanna Reinhold. And we love helping. I think with COVID, it's been much more challenging. We talk a lot on the phone rather than seeing people in person, but we're still making the best of it, and we're still sending people home during this pandemic. And I'm really happy to be working in this position with Senior Resources. Thank you.
Great, thanks. And now we'll have Joyce talk about the expos.
Hi, my name is Joyce Goodkin. I'm the Consumer Information Specialist at Senior Resources. I've been there for 15 years, and one aspect of my job is to coordinate the Healthy Living Expos. The Healthy Living Expos are a health fair focused on the senior population. The expos offer information and assistance in healthcare, finance, housing, utilities, and so much more. There are free health screenings offered, such as fall prevention, balance screenings, vascular, ultrasound, flu shots, hearing screenings, and blood pressure checks, just to name a few. There are also many giveaways, free raffles, and an art exhibit. The expos are free of charge. They provide a wealth of information and are always handicap accessible. Next slide, please.
Great, thanks, Joyce. And this is Allison again, and now I'm going to be talking to you from my registered dietitian role, which is really my comfort zone. That's when I started with Senior Resources about 10 years ago. To work with the home delivered meals participants and do nutrition education and counseling with them in their homes. So I've actually been in a lot of people's homes throughout Eastern Connecticut and worked with our fabulous nutrition providers, being TBCCA and Estuary Council of Seniors and CRT, currently serving the region that we work in. I've been a registered dietitian for over 25 years, and most of my career has been working with older adults in both hospital, rehab, and the community. So I'm going to highlight the fact that we're going to be doing a nutrition-focused webinar next month to go over all of the available information and access to services relating to nutrition and aging in Eastern Connecticut. So I hope you'll join us for that as well. And I don't think the registration's up on our website yet, but it will be soon. So the Older Americans Act funded senior nutrition program. I'll at least give that highlight. That is for anybody who is 60 or over. And so it's not based on income. There is a requested donation that helps the nutrition providers continue to provide those meals. And all those meals are healthy meals. They meet the dietary guidelines for Americans. So they are good for people with diabetes. They are good for people with cardiac issues. It's really just a fantastic program. Currently, they aren't having the congregate meals in any locations because of the virus, but those participants are being serviced through either grab and go formats where they pick up a meal at a senior center or usual nutrition site and take it back home with them. So I've eaten all the food. I can tell you it all is very tasty, and it includes milk and bread, and it's just a much different meal than you'd ever be able to find in the freezer aisle or any other location in the grocery store, and it works out to be a great deal for many people. Next slide, please. Hot off the presses, we have received our senior farmer market vouchers that we distribute to people, as have probably many other locations throughout Eastern Connecticut. So pretty soon the farmers markets may see a couple more people shopping. The Senior Farmer Market Voucher Program is funded through the Department of Agriculture, and it's really a win-win because it's providing $18 worth of vouchers to people who are 60 years of age or older, and who meet the income guidelines. And I'll tell you those in a sec. But so they get these voucher packets, and then they go to the farmer's market and they spend $18 buying fruits and vegetables. So the farmer gets money in their pocket and the senior gets vegetables in their home. I mean, does it get any better than that? You know, so it's a great program. We're very excited to be a part of it. I'm working with many of the towns that don't have other ways of getting the farmers market vouchers already, because there are so many different distribution sites. If you have any questions as to where to get them in your area, please give me a call and I'll talk you through that. The income guidelines, just to go over what is 185% of the federal poverty level this year. For a household of one, that's $1,968 per month. And for a household of two, that's $2,658 per month. And so if that's a married couple or a household of two, each person gets a packet. So that's a nice feature as well. And because of the coronavirus this year, they've lightened up on any need for signatures on things, and people can send someone else to do their shopping if need be. So really can't say enough about how excited I am for that program, and hope you join next month where we can talk more about nutrition, because I love that. All right, next slide, please. So continuing to talk about talking is all the different kinds of information, seminars, and programs that we like to provide out in the community. And if you're looking for speakers, or if you're looking for programs to be offered, please contact us, because we're free. We're here. We often say that we're the best kept secret that should not be a secret. We have so much knowledge and information to share on a lot of different topics. So Joan and Robin referred to the Dementia Friends program and the Powerful Tools for Caregivers. We also have all of those Live Well programs for diabetes, chronic disease, pain. We talk about estate planning or advanced care directives. Very basically, we're not estate planners or lawyers, but we do some general information there. And the Medicare boot camps that Laura referred to, what a fantastic way for anybody who knows anybody who's going to be on Medicare, which, hint, hint, is all of us. The Medicare boot camps are a great way to learn about Medicare and what it is and what it isn't, and what it means when you see things on the TV commercials. So I highly recommend a Medicare boot camp for anybody and everybody. And then the Senior Medical Care Patrol, we do outreach. And then the Senior Resources 101, we actually do a lot of these programs. We're working towards making all of these web-based programs to be recorded and accessible on our website. They're not there yet, but they hopefully will be soon, in somewhat of like a video library. We're also doing some other videos on, I've done several on nutrition that are on YouTube and Facebook. So if you have a need for a speaker, contact us. And if we can't do it, we'll certainly reach out to our network of people to see if there's somebody that can. Next slide, please. So here is where you registered for this webinar on seniorresourcesec.org. That is our website, and that is where we're linking through to a lot of our upcoming programs and services. You can also be on our constant contact email list, and we send out a monthly news you can use electronic newsletter that has a lot of the information about the programs that we have coming up. So this is a great way for both professionals and consumers to get good, honest information. We're never selling anything. We just want to make sure people have good information to work with. So those are the programs that are coming up. Next slide, please. We also work with a variety of professionals throughout our 56-town region through something that's called the M teams, and that's short for multidisciplinary teams. So this is elder law care, elder attorneys, and home care nurses, and assisted living directors, and social workers, and senior center directors. It's a mix of all kinds of people that come to the table to discuss things that are kind of founded in elder justice, meaning that if any of us are facing kind of a sticky case that we just don't know what to do with, we are in a closed room and we can kind of just share ideas and thoughts with people who work in that same area about how can we help this person who is somewhat challenging to us. So a lot of things have been very helpful for specific cases, but it's also that fantastic networking with these other individuals that work in our region. So if you're interested in joining the M teams, we'll start up again in September, and they will likely be virtual meetings again. So hopefully you can participate in that. All right, next slide, please, and I'll pass it off to Kathy.
Hi, as Allison said, I'm Kathy Chase, and I'm the Director of Contracts for Senior Resources. I've been with the agency for 19 years in this role, and I work with a wide variety of providers who are doing great work to improve the lives of Connecticut residents as they age. I oversee federal and state funding that provides programs and services to people 60 years of age and older throughout Eastern Connecticut, that big map, half of the map that we cover that you saw earlier. Currently, we provide over $650,000 to nonprofit agencies, 18 of them to be exact right now this fiscal year, with 23 contracts, so they can provide services in their community to improve the lives of older adults. We are always looking for new agencies to request funding in order to reach any unserved areas. You can start a new service or expand an existing service. Some of the examples of programs we fund are transportation, home health aides. We have a dental program, mental health counseling, adult daycare, and benefits counseling, just to name a few. Some services are funded year after year, and some are short-term. Another funding source that we have funds evidence-based health promotion programs such as fall prevention, walk with ease, chronic disease self-management that you heard about earlier, diabetes self-management, and many more. In addition to this, I manage funds that provide home-delivered and congregate meals through the Senior Nutrition Program, and there is additional separate funding for this, and that's a little over $2 million. It's somewhere between $2.1, $2.3 million. That's a separate funding source for these meals. And we strive to ensure that important services are available to the aging population, that funds are used efficiently and effectively, and that's part of my job. Nonprofit agencies wishing to apply for funds should contact me for further information, and I'd be happy to introduce you to the process. There is also a lot of information on our website, including the entirely paperless application. Thank you.
Great, thanks, Kath. Next slide. And so if anybody here is interested in being a volunteer with our agency, we can't do it alone. We're a small crew here. So we're always looking for board members and advisory council members. Advisory council is actually a great role for somebody who may be over 60 and can actually provide more input into how our programs and services impact the area. And as Laura mentioned, the Choices counselors do need to go through a fair amount of training, but they do a fantastic work out reaching many of our population, SMP volunteers, and also Live Well trainers. Particularly anybody that might be Spanish speaking, we would love to have you too, because we really need to reach the entire population in this area. So any more information on that, please contact Erica or anybody within the agency. Okay, next slide, please. As you can tell, I'm talking a little faster because we're approaching our 3 o'clock time frame, and I wanted to make sure that we offer the opportunity to answer any questions. I'm not seeing any questions in the chat, so we will allow people to unmute if they do have any questions. But here is our contact information, our address. Although our office is currently physically closed to the public, we are all still working remotely. The phones still work. We answer all the phone calls live. We all are still on our emails and contacting people all the time, and all the information you can find through our website. And we have a pretty active Facebook page as well. If you're on Facebook, follow us there. We do a lot of sharing of information with our other sister agencies and other programs and services that might be of interest. And we have a growing YouTube link there. Hopefully we'll expand more on different little informational blurbs there. So if anybody has any questions, you can try to unmute yourselves to ask the question, or still feel free to send it in through the chat. Or if any other senior resources staff had something else they thought of that they forgot to say that they want to say, now would be the time to say it.
Hi, this is Joan Wessel. I'm back again. I just wanted to thank everyone for participating this afternoon. Allison did a great job. Our team members all did a wonderful job of presenting their very difficult jobs, especially during this time of COVID and working remotely. As Allison mentioned, the doors of our office are locked. The staff are doing the best job in the world under very, very difficult circumstances right now. So I just wanted to thank you all, and absolutely take the information off this screen, and feel free to give us a call or contact us directly, and we will do our best to help you out. Thank you for coming today.
Absolutely. Thank you, Joan. And I will stop the recording now.